Thank you. I'm Prabhav. Alex is in the front row. We're the founders of inPhood, and we make text-based healthcare solutions. So as many of you are aware, healthcare is moving from a disease management model to a prevention model. And one of the cornerstones of that is the diabetes prevention model that Cameron talked about. So how many people here have a friend or family member that's pre-diabetic or type 2 diabetic? A couple of hands, yeah. So 86 million people are pre-diabetic in America, and that's as of 2014. I'm sure that's higher now. But the alarming number is only 0.04% of them have gone through the diabetes prevention program. So that was set up in 2012, and this number is from 2016. So there's a great divide between the number of pre-diabetics and the diabetes prevention program that's available for Americans. And starting in 2018, that's going to be a paid benefit for Medicare and Medi-Cal. So that's exactly where we come in. We realize that there are great DPP programs available online and in person, and we want to connect people through text to these programs and making it easy for them to understand their risk for it. So our solution is a one-stop solution. You can take a pre-diabetes risk assessment, find a primary care physician, and also get an A1C test scheduled and find the best DPP that fits your needs and for language or convenience. And Alex now is going to demo our Slack bot through YouTube.
So what you're looking at is adding the inPhood bot to a Slack environment. And we have a virtual user, Sandra, here, who's typed help. And you can see what our offerings are in this environment. So she's chosen to take our risk test, which is the American Diabetes Association's type 2 risk assessment. And it's asking her questions about whether her family members have had type 2 diabetes, what age she is, etc. And one of the things that we originally did this for a programming competition and have decided to grow it into this space because to employers, the cost of a person on type 2 diabetes is about $8,000 a year. So by putting it into Slack, we want to make it very, very convenient for people in their work environment to actually find out if they're at risk. And as you can see, Sandra has just found out that she's actually at risk. And it's asking her if we would be able to help her, or sorry, if we'd like to help her find a doctor to get an A1C test. So to do that, it's collecting her zip code, her health plan, and it's going to use the Better Doctors API to provide a list of doctors in her area. So we've kind of gone beyond what we did a couple of weeks ago and actually added that clinic information and pictures, and then we've actually added a DPP locator that you can see here. Now, in this particular case, Sandra's going to choose the online option, and it recommends Omada in this particular instance. But you can imagine somebody who's busy, they're working in a startup, they're on Slack, this online option makes sense, but we also have in-person options through the YMCA and other people that we're working with. So this is our offering for the corporate environment, and as I said, we're kind of experimenting with that. And our other product is actually a very lowest common denominator solution that's entirely text-based from an SMS or messaging platform. So, thank you.
Any questions?
Yeah.
I really like the idea. Have you considered maybe asking the users if they already have a PCP and then sending their PCP a message? Because an A1C is a pretty relatively standard flat.
Yeah, so those are some of the options we got to add. Like if you already have an A1C test and directly going to a DPP. So initially when you showed the help options, you can just type DPP if you want to directly go. And one other thing that we wanted to mention is for example, Omada, you can enroll without an A1C test if you just want to enroll into a pre-diabetes program. Yep.
I'm not an expert on Slack and privacy in the enterprise, but my understanding is in general, workers have zero expectation of privacy about everything except their personal phone calls and what they do in the bathroom. So every keystroke can be monitored by an employer, and you're doing a health survey. How does that work?
Are you getting at HIPAA?
Just privacy in general.
Basically,
Privacy in general.
Independent of
So-
HIPAA,
so-
why would I want to answer those questions at the workplace with no expectation?
You
of
might
privacy?
not wish to.
Yeah.
And one of the things that we would probably put in a full deployment would be a privacy message about the expectation that this information is not private. So certainly that. But if you were asking about HIPAA, what happens is that only pertains to information collected for a health insurance transaction,
Got it.
which we are not.
Got it.
So,
How do you translate this to an environment? Like, for example, my friends and my colleagues were on Slack. They
Mhm.
probably don't need this as much as, say, my parents' friends, for example.
Yeah.
How do you translate this to an environment where you meet people who need it most?
Yeah, so as Alex mentioned, we are also available in like SMS texting, so you can text our phone number, and it basically delivers the same pre-diabetes risk assessment, and based on your zip code, it will also tell you like the clinic where you can get an A1C. So right now, we have it set up for Santa Clara County, so that's the one that we're trying to grow to. That's the one that we have talked to public health plans about. So again, everybody that has a phone to be able to text to that number.
What's your business model?
So the SMS one, we want to target health plans, public health plans for that, and for this one, we want to target corporations to get their employees.
Yeah, 89% of people with prediabetes, as you alluded to, don't know they have it. And risk screeners are not a bad way, short of a blood test, to know. The challenge is that the defensibility of what you're doing is, I think, the major barrier that I see. Because we literally do that risk screener at Armada,
Sure.
right? Like, it's on our website. And the way that we get around the question that you asked in terms of privacy is, if they're comfortable, they can do it at their workplace, but if not, they can just put in their email, and then later on when they're at home, they can fill it out in the privacy of their own home on their personal computer. We've gotten decent, compliance with people filling it out. But it's tough because we've basically integrated what you have as part of our solution, and so we're a one-stop shop. And so I think it's challenging for like a health plan or employer to want to pay for you as a screening function, and then send you to a DPP provider that essentially does the same thing that you do. Given that you're early on, I always think it's best to focus on building companies that have some sort of defensibility. And the barrier of actually getting someone to make an appointment with a doctor, make sure it covers, their insurance, and then the pain of having a blood test done is a huge drop-off point, right? There's a little bit more incentive now because the Medicare Diabetes Prevention Act is probably going to require a blood test for Medicare to reimburse DPP tests. I actually think the biggest gap in this space is actually at-home A1C testing. So in the 3 papers that I published, we actually mailed A1C kits to people. And so they could actually literally do a whole capillary blood test at home. It gets mailed to a lab, they test their A1C, and we use that for our data analysis. There's not a lot of companies that are doing that. So I actually think if you can build like a fully integrated software and lab testing solution where you're mailing these kits to people and using that to make sure people qualify and can get reimbursed for DPP, then I think you have something that's defensible.
Yeah, that is one of the ideas that actually one of our advisors or team members, Hey Doctor, they do pre-diabetes tests. So we're talking to them about possibly getting those mailed out to people that are interested.
Okay, thank you.